Just one day to go before state and federally run health insurance exchanges open up for business, offering individuals a marketplace to shop for a new health care plan, all part of the Affordable Care Act. That's President Obama's signature legislation. Nightly Business Report asked Americans what they know and don't know about the exchanges opening up tomorrow. Take a look.
I'm happy with it because I don't have insurance right now, so it definitely gives me the impetus to make sure that I'm as efficient as possible in the next 2 months.
I think it's going to cost my husband's company a lot of money. He might have to think about letting people go.
A little tough being on the physician side, though. It does make things difficult on our end, but I think it increases access for patients to get care.
I'm going to have to pay more money and receive less benefits.
Health exchanges? Sorry, I don't know anything about it.
I think it's a good thing. We'll have to see. I like the idea.
So how do those insurance exchanges really work? Who should sign up, and how do you shop for a new plan? And what happens if you don't sign up for an individual health insurance plan tomorrow? Bertha Coombs has some answers to the most frequently asked questions people have about that Affordable Care Act.
If you buy insurance on your own, here are some things to think about. Open enrollment begins October 1st, but will run for 6 months until the end of March. Insurance coverage doesn't actually start until January, so you don't have to sign up until mid-December. Benefit analysts say take time to familiarize yourself with your options, like subsidies. You can only get those on exchange-qualified plans. How do you know if you qualify for a subsidy? Subsidies in the form of tax credits are applied on a sliding scale, depending on your annual income. As an individual, you'll be eligible if you earn up to $45,960 a year, up to $62,000 for a family of 2, and just over $94,000 for a family of 4. When it comes to the plans, there are 4 premium levels for most people, ranging from top-tier platinum, which covers 90% of costs, down to the lowest tier bronze, which covers 60%, meaning you'll have to cover 40% of your costs out of pocket. For those under 30, there's also a low-premium, high-deductible catastrophic plan option. Subsidies are calculated on the silver plan level, but can also be used to lower your premium for a bronze plan. If your employer provides your insurance, many of the Obamacare changes have already been in effect, like being able to insure your dependent children until age 26. If you're employed by a small business with fewer than 50 employees, your firm will have access to exchange plans. If your employer offers limited coverage, so-called mini-med plans, those no longer comply with the Affordable Care Act because plans can no longer set annual lifetime spending caps on coverage, which means if you have cancer or other critical care, you can no longer max out. For Nightly Business Report, I'm Bertha Coombs.
And for those on Medicare, the exchanges don't apply to you. Enrollment will be the same. Through the new health law, does cut out out-of-pocket